Good morning, everybody. It's time for the Orthopedic Minute with our friends from DMOS, and we do have Dr. Patricia Kallemeier joining us in studio right now, and we're talking everything that goes along with the hand, tendons, and things like that, Michelle.
That's right. We're going to get a little bit of an anatomy lesson this morning.
I brought a model for us.
So give us a better idea of what you're talking about. That's very helpful.
Yeah. Now, how common is tendon injuries in the hand?
Tendon injuries can happen with almost anything in the kitchen. Very common. Particularly, there was a big push around the Super Bowl time around avocado injuries. People slicing avocados and trying to get the pits out. And it can cause injuries to structures in the palm because it impales the palm when that happens. So it can happen in a number of injuries. We see it very frequently with industrial injuries, table saw injuries, snow blowers, etc.
Sure.
Anything that can cut the skin can cut a tendon.
Right.
So are we talking more about injuries or maybe repetitive use and so forth, or is that combination of
a combination. I thought we'd talk about a little bit of anatomy today because otherwise it's a little hard to understand what we're talking about, particularly with the tendonitis portion of this, the trigger finger part. So the tendons in the palm, I brought this model here today to show us the flexor tendons. And last time I was here, we talked about the carpal tunnel, and that's in this area. That's these blue structures here, the flexor tendons. And if you watch them go up, they go all the way up to the fingertips. There's 2 tendons per finger, and there's a covering to the finger called the flexor tendon sheath, which is visualized here, these white crossing structures that give the support to the tendons, they give nutrition to the tendons, but they can become a problem in trigger finger patients. So that's on the palm side, the flexor tendons, that allows your fingers to bend into a fist. On the back side of the hand, we see the extensor tendons, and these are long, wispy fibers. These are very interconnected for the fingers. The thumb has an independent tendon called the extensor pollicis longus, and then the index finger and small finger have their own separate tendons in addition to another muscle that extends.
So are those connected across the bridge
there? They are,
there?
yep. You can see on the back side here that they are interconnected, and sometimes that's can be part of the reason people don't know they have a tendon injury because the other part is still intact. So when we see patients who have lacerations, that's one of the things we always check is to make sure that they can bend their fingers. Sometimes people think, oh, it hurts too much, I can't bend it because it hurts. That shouldn't be part of the reason why you can't bend a finger. So if you have a cut and you can't bend your finger, you should have it checked because there's something else going on. And a lot of times we'll see other injuries at the same time. We'll see injuries to nerves because the nerves are in very close association with the tendons. So if you have a numb spot and a finger that won't bend.
Okay, what about people that maybe their fingers are like the last 2 fingers on their hand are starting to get numb for any particular purpose?
So that can be a problem with a compressed nerve at the elbow.
Oh, really? Not even associated with your hand?
Similar to carpal tunnel, there's this phenomenon called cubital tunnel that can cause numbness in the small ring. It could come from the neck. It could come from a number of different areas where the nerves can be compressed.
A bunch of different things.
So when we talk trigger finger, what exactly is that? What does that mean?
So maybe we can roll the video. We have a video of a patient who has a trigger finger. It's a tendonitis, and what happens in trigger finger is the tendons are getting stuck, and they're actually getting stuck in a portion of the pulley sheath.
So it isn't necessarily the index finger?
No, it can be any finger. And actually the thumb and ring finger are the most common of the 2.
Okay.
So you can see how this patient's finger, she's not doing that on purpose. It is actually physically getting locked, and sometimes people even have to straighten it out manually with the other hand.
So, can that happen with your toes as well? Or is that a different?
No, that's a different.
All right, I want to show everybody something because I just tried this. And Doc, you were witness of this because I didn't know what was going on, and I didn't, and I realized you were coming here, and I'm glad you're here because look at my hand. I'm going to do this. This just started happening to me about 2 weeks ago.
And I bet it hurts right here if I push.
Ow!
Yeah.
No, okay. I'm going to close my hand like this. I have never tried this till just now. Now I'm going to try opening my hand. I'm not doing anything different. And then just
your index finger.
Yep, you have a trigger finger.
I'm going to do that one more time. And I'm not doing this on purpose. I'm not holding my hand.
But it doesn't feel good.
It's like cracking your knuckles
Isn't that
almost.
crazy?
Yeah, it's just stuck.
Yeah,
And so what happens?
So,
What can I do?
So if we go back to the model,
It just freaks me out.
the tendons are getting caught on this structure right here called the A1 pulley. This structure.
Okay.
And that
right here.
pulley is what we cut at the time of surgery.
Okay.
Trigger fingers can be treated also with steroid injections, sometimes splints, and anti-inflammatories can be the first treatment that we offer in the correct
But
patient.
how did that happen? I haven't done any. I don't have a gun.
And it can happen just to anybody. It doesn't have to be an injury. Sometimes we do see it in after an injury.
Okay.
Inflammation around the tendons can cause those tendons to thicken, and actually a nodule develops on the tendon, and then the tendon gets stuck on this structure right here called the A1 pulley.
Okay.
Right there.
So that you can fix this.
Yes.
Talk about
yep.
maybe and what that process looks like, and
So,
how long, is it a long recovery time?
Depending on the patient, it can be done with the patient asleep for surgery, like under a general anesthetic, which is not typical.
Okay.
As you see, it is a dynamic process, so having the patient awake enough to show you that the tendon no longer is catching can be very helpful. So we do these in the office typically,
Really?
or it can be done in surgery with some mild sedation.
And what kind of recovery time do we have then?
Stitches are in the palm. When we finish, we put stitches in. They stay in about 10 days.
Okay.
We ask you not to use it overly. We don't want to pop a stitch out for that first 10 days.
Well, that's really bizarre.
So if people want to come in and maybe, can you offer a consultation to
Yes.
find out more information, or do they need to be referred by a doctor? How does
We
that
take
work?
self-referrals.
Okay.
We have, 4 hand surgeons in our office now. We have an urgent injury clinic that sees patients with this.
Okay.
If you have, time
that-
constraints and can only come in the evening hours. It's a very common problem. That's why we brought it to you today.
No kidding.
DMOS.com, DMOS.com. Find
Wow.
out more information and all the different services that they provide there.
Dr. Patricia, thank you so much for being here.
you're
More ways than
welcome. For that
one.
lesson, there's a lot going on in our hands. And,
Fantastic.
All right, it's